Now, the National Planning Commission says the COVID-19 crisis has brought into sharp focus the realities and experiences of the poorest people in South Africa. And that, in turn, is also raising serious questions about existing and more recent health inequalities. I want to talk now to Commissioner Ntuthako Bhengu, who is with the National Planning Commission and joins me now on Monday lunchtime. Dr. Bhengu, good afternoon to you. You're concerned that COVID-19 has exacerbated inequalities that we know exist already. In what respect has the problem got worse?
Thank you, Jeremy. Good afternoon to you and your viewers. Yeah, I think on a very superficial level, of course, we see that with the surges, hospital beds are getting scarcer and scarcer, and of course the public sector fills up first. And we're saying a huge portion of our citizens do not really have an option, as we know that private sector prices are high. So they really have to deal with the issues that go with maximum capacity that we see at hospitals. But more than just direct health problems, we need to remember that a lot of health problems are a result of social determinants of health, meaning if those aren't managed well, they are translated into health problems. What am I talking about? I'm talking about unavailability of just clean water. And in COVID, you can see that the issue of washing hands is absolutely critical. So those who don't really have running water are at a disadvantage. It's access to food and basic services. And we obviously quite rightly emphasize that the need to eat properly is certainly important in boosting our immunity, but the issues of poor nutrition are well known and endemic. Now add that to loss of incomes, and that there is no financial, security at the best of times. So all of these cues where people are going to get the grants with social distancing, that's not really possible. We talk about accommodation that doesn't allow for social distancing. Mass transport, where you have to be in a minibus.
It is, Doctor, it's an endless list. Dr. Bhengu, I wonder if I can ask you this question. As I speak to you, the aeroplane from India carrying 1 million doses of the vaccine is due to arrive in South Africa. Obviously, the priority there will be healthcare workers, frontline workers first. But are you concerned in the longer term as the Commission that poorer South Africans are at the back of the COVID-19 treatment queue? Are you concerned there will be less access to the vaccine the less money you have?
Yeah, look, I think the point is that there are efforts. For example, we do know that it will be free of a point of service, which is in line with what government has announced. And the medical schemes, of course, will provide cover for its members who qualify. But I think there has been an attempt to not necessarily make affordability as the primary qualifier. But as we say, healthcare workers are frontline. Whether or not you do or you can afford private care, it's not so much an issue. But look, the reality is that it's complicated. But I do think that there has been an effort to not make affordability the primary reason for someone to get a vaccine or not.
Just a final question. In a very extensive report, you've also lamented the lack of regulatory capacity to authorize new drugs. At some point, South Africa will start manufacturing its own COVID-19 vaccine. Are you concerned about the manufacturing limitation and regulatory limitation that exists right now?
Yes, we certainly are, and we've communicated as much in the recently released report that the NPC commissioned And we are saying that this has been a case that has been on the table for far too long. If anything, COVID has actually highlighted how critical it is the longer we delay. And we are talking about vaccine nationalism now. We really are dependent on other countries. And in our webinar that we had, we invited as well the Department of Trade and Industry, who drive policy, as well with the Department of Health, but also some experts who can help on formulating policy on drug discovery and local manufacturing. For example, active pharmaceutical ingredients make up 60-70% of any formulation of medicines, but we certainly have zero capacity locally to manufacture that. So it's not just that that capacity would help us regarding bringing down the cost of medicines, but it will help us deal with the big challenge of securing supply. The COVID vaccine explains, or sort of shows this in a manner that can no longer be denied. And the question is, will we learn from it to make sure that we deal with the poor coordination that we see within the departments that should drive localization of manufacturing and drug development? It indeed would be a missed opportunity if we did not move ahead and, of course, working with the South African Health Products Regulatory Authority.
Right. Dr. Bhengu, you've raised some very interesting points, so I'm going to have to leave it at that point. Time, unfortunately, is always against us, but I do appreciate the insight. Commissioner Ntuthako Bhengu is a commissioner with the National Planning Commission.